Thank you so much, Aluki and Lorena, for such thought-provoking presentations. I'd like now to switch over to the question and answer section of this webinar. We've had a few come in while you've been speaking, so we're just going to go from the first one that we've gotten. This attendee is asking, it says, it seems that the lack of standardized oral and written versions of Inuktitut, such as what exists in Greenland, is the single largest barrier for Inuit youth who didn't learn Inuktitut growing up and who want to learn it as a second language. Do you think there is a rift between older Inuit and younger Inuit when it comes to the issue of oral and written Inuktitut standardization? And how would you resolve that? Aluki?
I know that nationally, there's the 4 Inuit regions across Canada, Nunavut being one of them. I know nationally there's some work being done to develop a standardized writing system. I think the intention has always been to appreciate the different dialects that Inuit speak, but understand that Inuktitut has never been a written language. It's always been oral. And now that we have a writing system to kind of decide on what writing system would work across the nation, with the view that we'd be able to share resources and materials across Inuit Nunangat. So I think that's what we're going to continue to work on. And I think that similar to different dialects, even people who speak English, you can hear the different ways in which people who speak English speak. I think we would still maintain that in our communities.
So is there a language course in Canada or online through a Canadian college or university that either of you are aware of to help certify teachers in Indigenous languages?
I can't speak up for Nunavut, but I know in the south here, there's one Indigenous certification program that was developed by Andrea Bear-Nicholas out east. The problem becomes when programs are developed, whether the provinces or the territories are going to recognize those teachers in the classroom if they're going into K-12. And to the best of my knowledge, I don't know of one program yet that certifies Indigenous language teachers to go into a classroom from K-12. It's a different story if we are going to hire language teachers in universities. They don't require the province or the territories to certify those teachers. It's just a matter of universities recognizing the experience that those teachers have and hire them based on those qualifications. I guess for the issue that we faced here down in the south, we need to revitalize our language to the point where we have fluent speakers around. And all the research and what language teachers are saying in the communities is that in order to create fluent speakers, we need to focus on immersion programs for children. So the reality is that we do need programs that certify language teachers that are recognized by the province and the territories in order to have language teachers in the classroom. And that's our reality down in the south. I know that I've spoken to Aluki about some of the challenges that they have with getting certified teachers in the classroom up in Nunavut, and maybe she could speak to that.
In terms of Nunavut, there's a Nunavut teacher education program, and I know that at one point, Inuktitut, abilities to speak Inuktitut was one of the requirements to be able to take part in that program. But that requirement has since changed. So now a person who's unable to speak Inuktitut, because it's a territorial public government, a person who's unable to speak Inuktitut is able to take that program and become a certified teacher. One of the things that NTI has been advocating for is to increase the number of Inuktitut speaking teachers within our school system. And we have been encouraging strongly the government of Nunavut to become more proactive in ensuring we have more Inuktitut speaking teachers. We're aware that there's a large pool of Inuit substitute teachers that don't have the credentials and so are not full-fledged teachers, but they do work as substitute teachers in the schools when the teacher is unable to be at school. And so we've been encouraging the government to target that pool of people to become teachers. The other thing that we've been advocating for is that there should be money and funds put forward to ensure and support the establishment of training for Inuit language specialists that would be in our schools to ensure that Inuktitut is readily available from kindergarten to 12.
Thank you, Lorena and Aluki. We have another question coming in, wondering if there is funding for a fluent Inuktitut language speaker or English language interpreter to be present when elders access medical services such as a specialist appointment in the South. Aluki, are you aware of funding or patient liaison programs that do that?
Well, I know that through the territorial public government, often patients, when they're being sent down south to Ottawa, Edmonton, Winnipeg, may have escorts depending on the circumstances that they find themselves. And I know in Ottawa, there's a service provided by an Inuit health service provider to ensure that there's interpreters available for patients. But even those services, I know that we hear often of individuals not being able to have interpreters readily available. And I'm thinking particularly now we have a situation where there's elders that are being sent to Ottawa to live in an elder's home because the services are not available in Nunavut. And so often we hear about the inabilities of elders to be able to speak Inuktitut and missing culturally appropriate programming and food. I mean, it sounds so basic, but Inuit food is not so readily available in Ottawa. So those are the types of things that I think that challenge our health system.
Definitely. So given the lack of resources to learn Indigenous languages, especially at an academic level, how can healthcare workers be expected to deliver any level of care in Indigenous languages? What can healthcare workers start doing now to make sure this trend does not continue? Lorena, would you like to start?
Well, I know here in Manitoba, there's a position in the hospitals for Indigenous people to act as translators, but I think it's more cultural translators at this point. There are elders that are still fluent in Indigenous languages, but we're seeing fewer and fewer people under the age of 65 that can speak in Indigenous languages, but they might come from a community where they might need cultural translation for the way that they might be describing their pains and ailments. They might need an advocate to be able to properly translate what that is. I think you can see the situation of language speakers is very different in the South, where we might be focusing on the revitalization of Indigenous languages as part of our health goals, to be able to have young people speaking Indigenous languages. I think the need for having translators, language translators, would probably be more of the aging population. And I don't know of any specific funding initiatives in that area, but that's not something that I've done a lot of research in.
From my perspective, when an individual who speaks an Indigenous language and goes to a public service system, the expectation, I'm thinking specifically in Nunavut, should be, and the expectation of the whole system is that the Inuk would be able to receive the service in Inuktitut. And I think that's what we've been advocating for as NTI, is that Inuktitut needs to be recognized as a founding language of the creation of Nunavut. And when I say that, the expectation would be that the adequate resources and support would then be provided similar to the way in which French is supported in jurisdictions where it's not a majority, or where English is supported in Quebec, for instance. And I think that type of expectation needs to be well articulated stronger and louder by Indigenous populations. Because why is it the individual Indigenous person's responsibility when they're not feeling well to advocate for their language rights? It's the responsibility of the system to change to provide those services so that they're better able to serve the Indigenous person whose first language and preferred language is their mother tongue.
Thank you. I'm wondering about language nests and if these are in Canada and how they might work, if you're aware of these. Lorena, would you like to start?
Sure. I think the creation of language nests started in New Zealand by the Maori when they noticed that the languages were dying, that fewer and fewer of the younger population were speaking the Maori language, much like what's happening here in Canada. And there have been efforts across Canada in various communities to start up programs in preschool so that elders could, sing songs and speak to kids before they enter grade school in the languages. And there are some available, but I don't know of any here in Manitoba that are still functioning. I know that there were a few of them that have been started, but I think part of the problem is having support for those kind of programs to be maintained. I know some communities have used Head Start funding to incorporate the speaking of Indigenous languages in the communities to kids. But I don't think by and large that that's a movement in the South here. But I think it's something important that we do need to talk about. And I think something else to look for within the legislation that's being proposed. Will this legislation support Indigenous communities that do want to start language nests, and how would that work? That idea, along with a number of other ideas that communities have proposed for language revitalization, need to be discussed. And I think it also speaks to the importance of having a national Indigenous language institution so that we could have these kind of discussions and to talk about what's working and what's not.
In Nunavut, I mentioned that the public majority are Inuit and their mother tongue, the majority is Inuktitut. Despite that, it's astounding to me how quickly the number of language speakers can decrease. And in a family, you can see that happening. And I think it's very concerning. In Iqaluit, because it's a capital and many people move there for work, and the population makeup has changed over a period of time, you can see that people are reverting to speaking English much more readily. So in Iqaluit, there's Tumikulut Saipakavik, an Inuktitut daycare. Their whole sole purpose and what they encourage is that anyone who walks in speaks Inuktitut. So the children who go there have to have an Inuktitut-speaking parent that is able to speak Inuktitut at home. And the purpose of that is not only is it to provide childcare, but to also provide the environment where Inuktitut is the priority of this family and this community. And so we see these children going through that daycare and then going into kindergarten already very strong in Inuktitut. And it's a way to try and reverse the trend of people speaking English. And it's quite amazing that even though we have a public majority made up of Inuit and Inuktitut speakers, that so many of our institutions are English speaking in the work that they do. So Tumikulut Saipakavik is an example where the conscious decision has been made to make sure that it's Inuktitut and to try and have things that are Inuit appropriate or culturally appropriate. So the idea is that, and I hope that over time we're able to have more, for instance, Kamutingoa, like the sleds, and amautis made for children so that they can emulate what they see in their communities rather than playing with toys. I mean, obviously they'll continue to play with toys from the South, but try and bring in Inuit culturally appropriate toys and have them available in our daycare facilities.
So we have two questions coming in that I think can kind of be blended together. How can frontline workers be good advocates for growing language services, and how do people get involved in language activism?
Well, I don't know if I would classify the services for language services as growing. I think that's something that we need to tackle as being a reality. That being said, there are a number of language revitalization programs that are popping up at a variety of post-secondary institutions. I know that the University of Victoria has worked very hard in developing programs around Indigenous language revitalization. The University of Saskatchewan and Alberta, I think, have also started to work at the post-secondary level. And this is not just learning Indigenous languages, but learning how to work in the area of Indigenous language revitalization and activism. I think another way for people to get involved is to learn about the history and to talk about it. I was just invited to my daughter's school to talk to children in grades 7 and 8. And I was astonished that the majority of them didn't even know that there were so many Indigenous languages that exist in Canada, and the history that people of my generation and my parents' generation have experienced, violence and cultural genocide that still has an impact today. I think people need to be aware of that and to be talking about that in this country, because that history is all our history. And we have a lot of things to be proud of in terms of language history. We don't have so much to be proud of in terms of how we've been treating not only Indigenous languages, but I guess the French language community as well. And we have to hold the government accountable to that. So once you know the history, get out and talk to your MPs, push for important areas such as immersion programs here in the South. We need immersion programs. We need them to be supported. We need the government to support the certification of Indigenous language teachers. We don't even have a class here in Manitoba to certify teachers to go into the classroom. So once you get informed, I think you'll see a lot of different areas that people can speak to and advocate for Indigenous peoples and Indigenous languages in Canada.
In Nunavut, Inuktitut is recognized as an official language of our territories through the Official Languages Act, as well as through the Inuit Language Protection Act. And so we have these legislation that in law protect Inuit languages. Yet in day-to-day practice, I don't think it's been implemented fully to the point where it's a working language of our public government. And I think there's a role to play for Inuktitut-speaking Inuit to start speaking Inuktitut when they call the government and speak in Inuktitut, because the government has an obligation to provide the service in Inuktitut. And so often as Inuit, we're so nice that when we realize a person is unable to understand us, we revert to speaking English. And even people who would more comfortably speak Inuktitut try and struggle and use their English that they're able to speak to try and communicate. And I think as Inuit, we need to start asserting our Inuit language rights. And I'm always saying it's an act of self-determination, the mere act of speaking a language without even putting up a protest. The mere fact that I speak Inuktitut is already an act of self-determination. And I think I would like to see as Inuit that we start seeing that, empowering each other to speak Inuktitut more and more when we go into the local stores, because that will require that management starts thinking about, okay, well, how am I going to ensure that there are Inuktitut-speaking frontline workers? And that will feed into the obligations that the governments have to achieve a representative workforce. So I think there's a responsibility as Inuktitut-speaking Inuit to speak Inuktitut more. But when you think about the workplace, I think there's also a space and responsibility for non-Inuktitut-speaking employees to provide a safe environment and an encouraging environment so that Inuit who would prefer to speak Inuktitut can start speaking Inuktitut and feel that it's okay and it's welcomed and accepted. And I'm thinking about supervisors, for instance, who cannot speak Inuktitut. They can have an active offer. They can say, we're going to have this meeting. We can ensure that there's an interpreter. And I think over time, it will become the norm, the way of doing things. I was struck when I went to Greenland once that all their meetings were in Kalaalleq, in Inuit language in Greenland, even though there were people who couldn't understand the Inuit language. And I remember asking, how is this possible? And they said, well, they've come to Greenland. So either they learn it or they ask someone what was said. And the impetus is on the person who's unable to answer rather than the people who are able to speak both Inuktitut and English. And I think I'd like to see Nunavut get to that point where we start asserting our language, because by being so nice, we're putting our own language in danger.
Thank you. So I have a question that's come in. It's a two-part question. What are the positive outcomes associated with being able to speak your traditional language? And what are some of the positive outcomes associated with health centers in particular, where Indigenous people can access services in their own language? Are there any resources or research in this area that you know of that would give further reading for participants?
In terms of the benefits of being able to speak your Indigenous languages, I think both Lorena and I alluded to it in our presentations, is that it's affirming who the people are and saying that your culture and your language and your existence is valuable and important to Canadian society, because historically and currently, the way in which our language and our cultures are marginalized, it eats up on our spirit of who we are. And I think that it is a catalyst to some of the social ills that we face in our communities. There's messages that we're not good enough, that our language is not good enough, that as though things are not valuable that we're able to provide. And I think a health center in particular, when you're thinking about the health center, often it's very focused on the physical well-being. But if I was able to speak about it broadly in terms of the well-being, by wearing down on the person's self-worth, that's creating issues for their mental health and their mental well-being. So I think a health center in particular has even more responsibility to ensure that the well-being of the whole person is being looked after. And when the majority population is Inuktitut speaking, then the idea that the services would be available in Inuktitut only seems commonsensical in my view. In terms of resources written about it, I can't think of anything off the top of my head.
I guess in terms of benefits, I think, Aluki and I emphasize the importance it is to our cultural identity. I'd like to speak to in terms of family relationships. My father's no longer alive, but my mother is, and she's a fluent speaker, and a lot of my aunts and uncles are fluent Cree speakers. The benefits for me would be able to sit down and have a family discussion in our language. And if we ever got to that point, we would be creating a living family life in our own language. I know that I've seen, young children that have attended immersion programs, and I can't even express into words the joy that these kids have when they see elders being happy about what they're saying. So the cultural connection to our identity, the cultural connection we would have to our families and to our elders would instill pride in who we are as Indigenous people. I think another benefit that I can think of is for some of us that go to ceremonies. A lot of our ceremonies are in our Indigenous languages. And when I go, we speak Anishinaabe in those ceremonies. I have to have somebody translate what the elders say in their prayers. Our philosophies, our traditional teachings, I don't have access to that because I can't always understand. I'm trying to learn, but it's a long road. So the benefit would be for me to have access to that oral history. And the list goes on. I think anybody who speaks another language sees the value in being able to speak that language, particularly if it's part of your cultural identity.
Great. Thank you. I think we have time for maybe one or two more questions. I have someone that is a settler from the Coast Salish territory, and he is indicating that he's seen situations in which members of his community are not able to access healthcare in the language of Punjabi, and he's wondering how Indigenous peoples and settlers can work together to support revitalization in healthcare. Lorena, did you want to start?
Well, I think that's an interesting and an important question, and one that I haven't thought about in terms of other languages other than French. I know that Canada is not the best country in the world to support language rights of any segment of the population, even though we have official language status of English and French. The French have been battling to support their language rights in court over the years and have had some very bad decisions come out, one just recently in BC. And the French language services have been cut in Ontario. And there was a mass demonstration in Ontario last month about that. And I think if you talk to any French language Canadians, they'll talk about the challenges that they face. And I think we as a nation of people that do speak different languages do need to talk about the challenges that we face and support one another. And maybe that is another form of activism that could be talked about. One of the other questions that came in asked about how to get involved. Well, maybe supporting the rights of people who don't speak English, looking at some of the challenges that they might face in health and education and asking those communities how they can be helpful. So this gentleman that is experiencing challenges with Punjabi, maybe that speaks to a larger challenge within Canada. We do have a language commissioner in Canada that people can direct questions about language rights issues, but I know it's one that Aboriginal people certainly haven't accessed because we don't have language rights recognized, but it's certainly, I think, something worth considering. Maybe that the role of that language commissioner should be examining language rights beyond French and English Canadians. So I don't know if I directly answered that question. I think it's thought-provoking and something that I'll definitely think more about.
To follow up on what Lorena has just said in terms of looking at language rights beyond French and English, I think that certainly is something that Canada needs to look at, because it is extremely frustrating when you're in a situation where you can see the inequities. For instance, in Nunavut, we can see that the federal government is providing funding to the territorial public government for French. I think it was at an absurdly higher rate than it would for Inuktitut language services, even though the public majority are Inuktitut speakers. And you see that inequity in so many different ways when you're living in Nunavut. And I think it's probably apparent in every part of this nation, but it seems acutely present in Nunavut. And I think that when we're looking at the different language rights, I often think about the context when we're speaking specifically about Nunavut, is that people came to Nunavut speaking a different language and placed a language expectation on the population of Nunavut. And now we're unable to function fully in the language that we grew up with, and so it just seems like the historical context is so important, whereas people who come to Canada from different countries where they speak different languages come to Canada often knowing that the official languages of the nation are French and English, whereas the Indigenous population of Canada have always been here speaking their own mother tongue. And it was Canada that has come upon them and said, now we recognize the official languages of this nation and this land are French and English, languages that were not the first language of the Indigenous population of Canada.
Thank you. I think we're at the end of our question and answer session in terms of timing. Aluki or Lorena, did you have any final comments you'd like to say before we wrap things up?
I just want to thank you for organizing the webinar. Language is such an important component of who we are, and it's so easy to get passionate about it, and it gets extremely frustrating when the systems don't seem to understand how important language is to a people and their well-being. And I think the opportunity to speak about it in the context of health services, of school services, is so crucially important. I really appreciate the opportunity to speak at this webinar.
I'd also like to thank everybody. I know there's a lot of work that is involved in putting these webinars together, and I feel so grateful that the National Collaborating Center has focused on Indigenous languages, particularly because it is UN Year of Indigenous Languages. The United Nations is focusing on Indigenous languages. So I would urge people to go to the UNESCO's website that has a lot of different activities. You can track what's going on around the world, conferences and different initiatives that are going on. But I think the last thing that I'd like to say, as I was listening to Aluki and about all the health challenges that Inuit people are experiencing in the healthcare system, I think that we need more opportunities to be able to have this kind of dialogue in the future. It's made me think about how we could use social media in this way. And the last thing that I'd like to say is that I guess when I was listening to Aluki talk about concrete experiences in the healthcare system without receiving adequate translation services and all the issues that raises, just the human impact that has, and even life-threatening instances, I think that's another layer of the history of the residential schools that has not been looked at. The language challenges that children had experienced in those schools is something that I thought of, but really not to a large extent. So I was thinking about what some of those young children might have experienced when they were in need of health care and weren't provided adequate health care because they weren't able to speak English or French to those teachers. And I don't know why, but it was just something that stuck out in my mind as we were doing our presentations and talking about healthcare issues. I think it's another layer to the legacy of the residential schools that need to be looked at.
Thank you so much, Lorena and Aluki, for your wonderful presentation. And yes, I would like to say good afternoon to everybody on the phone. Have a wonderful day.